friends, I'm Lauren Bernick, and I'm flipping the script about growing older. My guests have been influencers since before that was even a thing. Welcome to the Anti-Aging Podcast. Welcome to Age Like a Badass Mother. Dr. Deborah Shapiro is doubly board certified in obstetrics and gynecology, as well as lifestyle medicine. She is a certified health coach and vegan lifestyle coach and educator. She currently practices general gynecology at Genentech and coaches privately. She has been studying plant-based nutrition for 11 years and is vegan for ethical and environmental reasons. She loves to help folks regain their health and vitality using plant-based nutrition and other healthy lifestyle choices. You can find her through her website, anewviewoffood.com. Please welcome Dr. Deborah Shapiro. Hello. Welcome.
Hi. Hello. Thank you, Lauren. I'm so excited to be asked to be on your podcast.
Oh, I'm glad you're here. I've read so much about you and I love your story. Actually, let's just jump in and start. So for those of you who don't know, we're going to do a deep dive on menopause today and all things vagina, which is better than what I thought of saying. We're going to do a deep dive on your vagina, which is not good. So, and guys, you can listen too, because you might learn a thing and maybe you could stand to learn a thing. I don't know. So I'm just going to call you Deborah, if that's okay.
Yes,
Dr. Shapiro. Okay. So tell us a little bit maybe about your mother and her influence on you to become a doctor and how you came to this lifestyle.
Thank you. There was a lot of suffering in my family, and I grew up in a household with an ill mother, with a sick mother. I didn't realize it until I was looking back at it. As a child, I certainly didn't think that my mother was sick. I think she developed diabetes soon after I was born, and she had me when she was almost 40. So pretty early on, she had diabetes, which became very difficult to control, to the point where she was having to take multiple shots of insulin a day. So when people talk about the smells from their mother's kitchen and, all the different wonderful smells from my kitchen, I remember distinctly this acrid smell of her boiling her needles and her syringes, because back in the day they didn't have disposables. So she'd be boiling them and there would just be this sort of alcohol-y smell. It was just, and she wasn't much of a cook. But I'll tell you what I learned later was, of course, everything we ate made it impossible for her to manage her diabetes. We started with eggs and cheese, and then we had processed meat for lunch, and we had tuna fish for lunch, and we had, and you know how eggs are for diabetes, right? And then processed meat, and then just, chicken, and, maybe there was some canned or frozen, a lot of bird's eye frozen peas and carrots, which I was always forced to eat. But, and so I grew up not liking vegetables at all. And I was just raised on a lot of dairy. So when I was 14, we had to stop. We were taking a little trip. My mother was a little agoraphobic, you can imagine, because she had to somehow get her shot in at 5 and then eat at 5:30. It was all very regimented. And so we didn't really go anywhere except maybe down the shore in New Jersey for a week in the summer. But, we weren't people who would go places. But we had this trip planned. Do you mind if I tell you this story? I hardly ever tell
tell
this story.
me.
You sure? Okay.
I would love to hear it.
We had this trip planned. I mean, maybe people can relate, with illness really interfering with the family. But we had this trip planned to go up to Maine, and then even up to Nova Scotia. But we just got to just over the border into Maine, and something happened, and we had to turn back. And I wasn't really told, because I was only 14, and I was very much kept a baby. I was the child, like the baby in the family. I was sort of an oops child. My closest siblings were 13, 15, and 17 years older.
Oh, wow.
And so I was sort of an only child. And so we turned back. And what I found out later, because a few months after that, my mother collapsed in the bathroom one morning and was practically in a coma, is that she had actually, I don't think it was a small stroke. I actually think she lost some peripheral vision. Something was happening, but she didn't get it checked out. So she ended up with with a brain tumor, and she died when I
Mm.
was 15 after 6 months. And
Oh
so that
gosh.
was a very determinative time in my life. I had always wanted to be a doctor. My mother actually had gone to medical school for a year when she was quite young, and which in South Africa, where she had grown up for 10 years. And my father was a doctor. My uncle's a doctor, and I just assumed I would be a doctor.
That's quite a story, and I can see how that could set you on your trajectory. To why'd you pick OBGYN?
So this is the one specialty where you get to do general health care, where you get to do surgery, and you have this amazing opportunity to be with women when they are the strongest that they've ever been in their lives, it's like the
Yeah.
pinnacle of their strength. And that's something that's always given me this incredible burst of energy when I'm in a room with somebody who's delivering. So I could have just been a midwife, I suppose, but I did like doing surgery. It was exciting, frightening, stressful, but rewarding. So all of that.
Yeah.
So that's why I became an OBGYN, because it's the best
That's
specialty.
yeah. I think you're right. Okay, well, let's talk about menopause. So first, I want to say, and I'm sorry to the people who listen to my podcast all the time that I've said this several times. I'm sure it's annoying, but I want people to understand that I'm 56. I haven't gone through menopause yet. I haven't even
Wow.
begun. I haven't had symptom one.
Yeah.
I'm still getting my period like regularly. And so I'm not trying to be annoying, but I just want you to know I don't have that shared experience. And I'm sure if I have this conversation when I go through menopause, it's going to
Mm.
be a different conversation.
Is that you have to have a healthy life leading up to it. And it's possible that all the way that you've been eating over the last 10 years, right? 9 or 10 years, this
Hmm.
healthy life, that's actually reduced the oxidative stress and allowed your ovaries to keep functioning. Because we know that actually the timing of menopause is determined by what you eat. So the research that I've done
Oh,
has been
really? I
incredible.
didn't know that.
Yes. Yeah. So even yes, oxidative stress damages the ovaries and the eggs, and so the less oxidative stress, the longer they'll keep going. I would think also. So I don't know if there are any studies specifically on that, but it's been said that it affects the timing of menopause. So I don't know, but also there's a genetic component, of course. And
Yes.
did your mom go through menopause late also?
Mm, my aunt, my mother, and my cousin all went through about at 52.
Hmm, yeah. Well, that's about average,
So that's
51, 52.
average. Hmm.
Yeah, yeah, but so it's wonderful that you have it. You probably have a very different diet than they did as well.
Yeah.
Yes, yeah,
Um, so why do we go through menopause, or what is
yeah.
actually
Okay,
happening in our bodies?
right. So we're born with a certain number of eggs. We're
Right.
born with a certain number of eggs, and they get recruited starting at. I mean, we probably lose some before, but especially starting at menarche when we first get our period. Um, um, we have a certain number that are going to be able to be ovulated. And every month, many are recruited, many just sort of die away, and a few and a couple are ovulated. And so when we get to the bottom of our ovarian reserve, when we've used up the good eggs, the eggs that can create the right amount of hormones and create, go along with it and create this cycle between the hypothalamus and the ovaries, the pituitary, the hypothalamus, and the ovaries, we stop. But there is that time before we've reached the very end called the perimenopause, where we've ovulated most of the sort of the good, we could say the good eggs, most
The
of the
good
eggs
eggs.
that the good eggs, most of the eggs that would be able to be fertilized, and so we have a variable amount of estrogen that's being created, and that can also be a very difficult time because there are symptoms, but there's also some bleeding. So, it's like there's nothing good is quite happening during the perimenopause. I can't really say much good about the perimenopause, except that soon you will be menopausal. And the definition of menopause is a year without a period. So the definition is not about a hormone level. There may be ranges, but it's really a definition based on the fact that you don't get a period for a year after you've had periods. And of course, we are talking about people who are born with uterus and ovaries, and there's certainly, when we talk about the word women, there's certainly people who identify as female, as women, but they don't have those organs. And so I'm not talking about that. I'm just talking about
Right.
people who, right. And that's actually interesting because we now use the term menopausal hormone therapy instead of hormone replacement therapy. And it's probably because with people being transgender, they're going to be taking hormone replacement therapy. I'm sort of making this
Okay.
up, but I think it makes sense because all of a sudden there's been this shift to call it menopausal hormone therapy instead of replacement.
Menopausal.
I
Okay.
don't, right.
Okay.
So we say MHT, not HRT.
Okay. Well, I want to talk about hormone replacement therapy, menopausal hormone
Menopausal
replacement
hormone therapy.
therapy. But
Okay.
before we get to that, let's talk about symptoms. When I put a call out to my listeners, I'm like, "What do you want me to talk to Dr.
Mm,
Deborah about?" And they sent in a list of symptoms. I'll read them: hot flashes, night sweats, insomnia, vaginal dryness, weight gain, lack of desire, eczema, inflammation, brain fog. Uh, what's that? Yeah, that was most of it. Hair loss, uh,
mm, mm,
bone loss.
mm, mm.
So what do you have to say about that? What can we do? Why
Right.
are we having
Uh,
that?
right. Okay. So first about the hot flashes, because I don't think I really got to that about why we have hot flashes. And we actually know a lot more about that now. There's a vasomotor instability that comes from the changes, the drop in estrogen, and we become more sensitive to small changes in temperature. So when there is a small increase in temperature, we we feel it very acutely, and um, we have this flush of heat. We have vasodilation. We sweat, and then we get cold, and um, and so that's mediated by um, a chemical in the body called neurokinin B. There's a neurokinin B receptor or a tachykinin receptor, I think, on chromosome 4, but this we can actually induce a hot flash by giving people this chemical called neurokinin B. The reason this is important is because there's now a neurokinin B receptor antagonist as a drug that you can take that will absolutely stop hot flashes without without increasing your risk of anything else, except it actually can have some effects on your liver and your kidneys. But they're working on one that's a little bit safer. So the one that's out now is called fezolinetant or Veoza. I've already been seeing ads for it. Have you seen any ads for it?
Vioza?
Veoz, yeah, Veozah. So this is
I
a
don't
it's a neurokinin
maybe.
B receptor antagonist. Yeah. And I think when they come up with, so this one you have to monitor some liver function tests, but it's just a daily pill and it will absolutely help with hot flashes. So for people who are really bothered with hot flashes, but they cannot take, anything else, hormones or, and, other kinds of drugs that might help because there are antidepressants that can help. There's SSRIs and other things like that. So, but if you just want to block the hot flash, we now have, because we know more about what initiated it.
Hmm.
So, but this whole idea of aging and all the things that can happen and the things that are accelerated with menopause, like bone loss that becomes accelerated without estrogen. I think we have to be thinking about, and I guess this goes back to what I said before, we have to be preparing for this time through our entire life. You need to be eating and knowing how to eat a very high antioxidant, high anti-inflammatory diet, full of fiber, full of soy, phytoestrogens, full of, with lots of flax, because there have been so many studies looking at this. A healthy diet, you're going to have less symptoms. You're going to feel better. I know because to go, I decided to become plant based right at the time I was going through menopause. And there
Hmm.
was a big change when I did this. So I could tell before I became plant based, I was hurting, I was aching, I was suffering more with hot flashes and night sweats. My hair was getting thinner. Many, what else? Oh, more, a little, more wrinkles, just everything. It wasn't, I had gained weight, right? So I had this sort of roll in the middle, this little thing under that I didn't like. And the thing you really notice is when I was coming down the stairs in the morning, every step I took kind of hurt my feet, my knees. I was sort of cranky and old. I was getting older, right? And I was only 52. And then I became plant-based, and all that went away. I lost the 20 pounds. My cholesterol came down. My weight came down. I lost that little bit there, little tire that I had there. And miraculously, my knees and my feet stopped hurting. And so even now, and it's over a decade later, I can come bouncing down the stairs without pain, feeling younger than I did before. And it's all about diet. I mean, the exercise, I was exercising. I was doing the elliptical and I was exercising. I don't think you can really exercise your way to health, but you can eat your way to health. So
Mhm.
it's really all about the food. And there's so many great studies that show that more antioxidants, having that antioxidant shield, having more anti-inflammatory foods, and eating less energy dense foods, less calorie dense foods. And we all know what those are, right? So less
So,
oils and crap and sugar and all of that will help.
well, not everybody knows, but what? So you're saying don't eat meat, don't eat dairy, don't eat oil, and focus on beans, like
Whole plant.
legumes, whole grains, vegetables,
Yeah.
fruits.
Yeah, Dr.
What if you
Greger's Daily Dozen. I use that all the
right.
time. That's what that's my sort of my guide. Yeah.
Yeah, and I think,
Yes.
we had Doctor, Neil Barnard on, and he was saying a half a cup of cooked soybeans every day was shown to
Yes.
reduce hot flashes as well. So
88%.
maybe
Yeah. So
yeah,
yeah,
so
so
you
that
could
was
try
this
that maybe
waves.
before the drugs.
Of course, of course, of course. That was the wave study and that he did. And he actually did two. There were two cohorts because he didn't want it to look like it was just the winter cohort. Those, if he did the study in the winter, that they were going to be cooler anyway, so they weren't going to suffer. So
Oh.
he did two. He did one in the spring and one in the fall. And and he showed that the women, they were randomized to a regular diet and I think they even got some education and some support, but the other group were told to eat a low oil, low fat, plant-based diet, so vegan diet, and they were also given an instant pot and they were given organic soybeans, and they were told to add half a cup of soybeans a day, and they found that group had an 88% reduction in the moderate to severe hot
Mm.
flashes. And also, there was a post hoc analysis by one of his researchers, um, Hanna Kaliova, who's amazing, and she showed that you could prove that there were less AGEs, advanced glycation end products, which are created when protein and sugar. Protein and sugar are cooked at high temperature. It's like the browning reaction
Oh,
or
Maillard
Maillard,
or
the
yeah.
Maillard reaction, right? So it's like that. What used to be on like blackened fish. I mean, anything that's sort of cooked at high temperature, especially dry heat, is going to have more advanced glycation end products. And these you can think of AGE as aging you because they're both inflammatory and they create oxidative stress. So very, very bad. But she showed that in that group that was eating better, eating healthier, and adding those extra soybeans, that they had tremendous reduction in their intake of advanced glycation end products. So
Hmm.
just another way you could say that oxidative stress came down. And there are other studies about oxidative stresses also having to do with menopausal symptoms. I think about the menopause not as a chronic disease state, but it is fascinating that in a way it is this dis-ease, right? There is this
Yeah.
dis-ease. And so the same factors that go into creating chronic disease, like inflammation, oxidative stress, too much, fat, lipotoxicity, and dysbiosis issues with the microbiome, they all play a role in our experience of menopause in the same
Hmm.
way that it would in, just for heart disease or for any other chronic condition.
Okay. Do do you think it's bad to use an air fryer if it like browns your tofu? Is that uh what you're talking about with the
Well, is it bad?
age?
So that's right. So let's say, is it bad? It, I think everyone you've had on has always said, compared to what?
Right.
So if right, so it is better just to have soybeans. Mature soybeans have more of the genistein than the uh, than edamame, so that's why they use mature soybeans. But and
Organic.
certainly Yes, yes, good. But the GMO soy is fed to animals, so I don't think you can. But
Right.
yes, right, you definitely get organic. So compared to what? So if you'll eat tofu, if it's in an air fryer, that's better than deep fat frying. Yes, for sure. Going out to a restaurant and getting it fried. So yes, but and I have not seen enough of the data about how whether AGEs are created in an air fryer. I think they are, but probably much less. But you can look at tables of AGEs. I mean, we're talking about people who normally eat, bacon and sausage,
Right.
but they're going to air fry some tofu. Tofu. So much
It's
better,
better.
so much
Okay.
better. Of course, of course. But if you
So,
had a choice to just put some even raw tofu, or on or steamed tofu
yeah, maybe
on
put
your food,
some.
that yeah, steamed is always better. Wet heat is better. It's going to create less. So when they
Okay.
look at these tables, the worst are the sausages and bacon, and the best are things like fruit, like orange juice has the lowest. So AGEs,
Okay.
advanced glycation
Okay.
products. Yeah.
Um, what about,
Mm.
so I a couple more questions about the symptoms. So I know
Yeah, we can
that
go through all of
I've
them
had
if you
some
want.
yeah, I had some people tell me that they eat this way already, but they still gained weight during menopause. Is there something else, and still got the little roll? Something else they could be doing?
Well, there definitely is weight gain, and there's definitely weight gain around the middle, and that amount, that weight gain, and the waist to hip ratio does correlate with symptoms, with hot flashes and night sweats. So you want to keep that down. So, well,
You want to
are
keep the
people,
hot flashes down because it
well, both, yeah.
okay.
Well, actually, you want to keep the weight gain down because that
Okay.
correlates with hot flashes,
Oh,
and
okay, okay.
hot flashes also seem to correlate with more oxidative stress in the body, and so how can you do that? Well, Dr. Greger has that book, How Not to Diet. So then there are all these little tips. I think there are 21, I think, tips and tweaks. If you're really talking about people who are eating exceptionally well, let, let me put it this way. There's vegan and there's vegan, and there's plant-based and there's plant-based, and there's eating at night. Now, you could be eating the healthiest food, but if you're eating it after 7 p.m., you're probably going to keep those calories on your body. And it doesn't take many calories extra a day to end up gaining 5 pounds a year, which is not what you want to do, right? So I think, and I'm saying this from my own experience, that I started sort of snacking and eating some walnuts at night, maybe because I hadn't gotten them in during the day and I felt like I needed to get my walnuts in, but it didn't do me any favors. So what do you think? I mean, do you think that when people are complaining about the weight gain, that they have done that they've done everything they can do?
I think this person probably is eating pretty well. And like I said, this is where I fall short because I don't know. Am I going to gain 10 pounds when I go through menopause? And I feel like I eat exceptionally well. I don't know. I might have a very different conversation about this. I'll have you back on, but so I
Well,
don't know, but I guess
well, time will tell with you, and we should talk about it. But
we will.
I don't think it's a given. I think you may put on 5 pounds. You put on 5 pounds if you take birth control pills too, right? 3 to 5 pounds. I don't think that really changes necessarily much. I think what we're worried about is, like, the 10, 20 pounds that the weight
Mhm.
that people put on during the pandemic. And I don't know, as people get older, we eat out more. I think we're sometimes not as aware. I'm not trying to blame anyone. I'm just saying that, and it's not that a calorie is a calorie is a calorie, because it isn't. It has to do with when you eat them. And, you could try all of those tips that he has in his book about, and how
Mhm.
not to diet, about how to lose that last few pounds, if that is so important to you. I'm not
Yeah.
even sure that 5 pounds makes a difference in your life, and maybe but if it does, then I guess you have to do everything you can, um, to get it down. Your
Yeah.
metabolism does slow a little bit, it's true. So
Mhm.
maybe you do have
Mhm.
to eat a little bit less at different ages, or maybe you do have to
Mhm.
exercise. The problem with exercising, and exercise is great. Exercise is great for your bones, absolutely great for your aerobic, may even be good for menopausal symptoms, but mostly it's good, for your bones and your outlook on life, and your vitality, but and your balance, of course, and not falling, and all of that. I'm not not saying, but you can also injure yourself, and that's not good. And you can also get really hungry and then feel like, oh, well, now I can have this cookie because I exercise. So that, no, don't do that, because there's no way that you can exercise enough to burn off, a piece of chocolate cake. It's just not going to happen. So that, I think that often happens with exercise. People say they're working out, they're working out, they're working out, and they're just getting bigger and bigger. Have you seen that
Right.
ever? I mean, I've seen it.
Yeah, a little bit, but I know that that happens to me sometimes too. I get so hungry. I mean, I think it's important to exercise and to, have some kind of balance, but it doesn't have to be crazy.
Right.
Um, what let's talk about sex because that's also like a very common complaint. Like either it's painful, um,
Yeah.
my vag is too dry, it's
Hmm.
for me, okay, I said I haven't had symptom 1, but I talked about this with Jane and Ann Esselstyn, that it is harder for me to have an orgasm, like, it takes me longer, and I said, now we have to get the vibrator involved, and then
Uh-huh.
I'm like, "Am
Right.
I numbing myself too much with my vibrator?" And I had a friend tell me, like, she's like, "I can't even come with my vibrator anymore." She's like, "I'm giving up." Like,
Wow.
what she's like, "If I can't even have an
Huh.
orgasm with my vibrator, what
Mm.
kind of world is this?" So,
Huh.
what
That
and I
that's
well,
in that's
it's
interesting.
interesting,
That is
right?
interesting, because when you think about everything that when you I know that and that Jane Esselstyn was talking about the number of nerve endings at our clitoris. It's so much greater than in the penis, and it's certainly true. But what? But she also mentioned, and this is true, that the biggest sex organ really is the brain. So getting your head in the right space. If you're eating a very healthy plant-based diet and your blood vessels are are clear, then it should be easier to reach orgasm. And I have to say, not to brag, but I mean, I think in my sometimes as people get older, especially if they're not worried about pregnancy, I don't think you should. I don't. It's not a given that it's going to be worse, but it's not. It's not. We do have more complicated lives. Often people at this age, I don't have kids, but a lot of people do have kids, and there's a lot of stress. The parents are getting older, and they're causing also a lot of stress. And I think the biggest interference with feeling sexy and feeling like you want to be intimate is just time and stress. The relationships can be
Yeah.
complex. So, but if you make a date and you get yourself in the mood by thinking about something, by thinking about how nice it will be to be intimate, to be connected, to be it's like, sex in some ways is like the cement, the glue that holds a relationship together, and it's
Yes.
important to keep that sort of in there. And so, but you do have to make it a plan. It's not going to be that spontaneous like it was when you were 20 and you had that amazing sex drive. The drive is different. It's but it doesn't mean it isn't there, but sometimes it actually isn't. Like, the desire comes after you become aroused, and
Right.
you have to get yourself aroused. So
Right.
it's all the change. It's all changed from what we were taught, but you do have to get yourself aroused. And you can get yourself aroused through um, some self stimulation, but you can also just get yourself aroused with fantasies and a
Mhm.
fantasy. And if you have um, and so in terms of the dryness, because that is a real thing. As someone who recently went to the gynecologist and was like yelling, ow, ow, ow. It is a real thing that the vagina gets stiff and drier and shortens and all of that. So there is that use it or lose it thing. If you want to have intercourse and put something into the vagina, then you should keep doing it. And you can definitely use a number of things to help. So you had one speaker who talked about, oh no, maybe yeah, I think that was it. Or although maybe I heard it somewhere else. Um, if someone really likes coconut oil as a lubricant, so you can use lubricants. And Dr. Greger actually has a video on the best lubricants and moisturizers to use that are safest because of their osmolality. And that
Mhm.
was fascinating. They
I
actually
wanna
talked
hear
about some
him talk
brand.
about lubricants just to hear him say lubricant. He's
But so moisturizers are things that you would use
Yeah.
every couple of days just to keep things a little moist, and a lubricant you would use for sex, and you could put over the penis or an object that you're going to put inside the vagina if you're using a vibrator. And if you want to keep the vagina open, or if it's already gotten very closed up, there are actually devices that you can use, like dilators that you can work on with maybe even with some vaginal estrogen, to get the vagina to be a little more elastic. So if you really want the vagina to increase its elasticity, I believe that you do need some vaginal estrogen, and vaginal estrogen is safe. It
Okay.
really is safe. So
Okay.
there are
Wait.
rings, and there are what
Oh, I was no, I
you
want
said.
keep going with that thought. There's what? Tell
Oh,
us.
okay. Well, so there are rings. There are vaginal rings like the S string or the E string, that are, these are things that are be just for vaginal estrogen, right? So there's the S string. There are creams like estrase cream, and they're little Vagifem tablets, and they've reduced the amounts. It's like 10 micrograms of estradiol. So so those are very safe, and that's what I would recommend. I think that there's some vaginal rejuvenation lasers that were popular, but I don't. I mean, they may help, um, to get the epithelium to change and to be a little bit better. But I think that's very expensive, and I would never recommend that. It's also something that has to be redone often, and so. But there's also a DAGA cream that works. So prasterone is another option for people, and there's even a pill that you can take that just helps with vaginal dryness as well. So I don't think I in terms of the clitoris, though, and how the clitoris functions, that's about vascularity, and I would think that that would work quite well. I think you had a discussion about whether people like to come with just intercourse, and very few people can do that, but there are certainly people who enjoy doing that. If we're going to be quite frank and you want to have this discussion, I think it's when I was having sex with men. I don't now, I haven't in a long time, but because I've been married to a woman for 30 years, but you can actually touch yourself. You can masturbate while you're having intercourse, and that's a way to reach orgasm together, which is sort of fun when you're having intercourse, and so that worked for me at the time. And I don't think people need to be afraid to do that. I know there's certainly women who have never masturbated, never touched themselves, and some women
What?
I've oh yeah, I've had patients who've never had an orgasm. Absolutely. They've never masturbated. They've never thought of touching themselves. So, I always say,
Damn.
it's yours. It's yours. It's
You
no
are
one
missing out,
else's.
girl. Touch
You're
it.
missing out. So yeah. So, and then, and so
Um,
know about it and know how it feels good. And so you can do that while you're having intercourse. You don't have to rely on just, and also of course oral sex, which is, I can't say
yeah.
enough about oral sex.
It's a
Right.
winner. Okay,
Right.
wait. I want to go back to one thing. You said moisturizer. I want to be clear. I don't think you're talking about the same stuff you put on your face, right? What
No,
kind of
no,
moisturizer do you put in your what?
there are
Vaginal
vaginal, yes,
moisturizers. Where do you get that?
yes. You can
What's
online
it
just look at
called?
Dr. Greger's.
I can't wait
You'd
to
have to look
hear
on
Dr.
his,
Greger
you'll have
talk
to
about
find it in
this.
his show. Yeah.
Okay.
He has a video where he talks about some specific brands. I don't, I think Replens makes a moisturizer, but I don't
Oh,
think that
okay.
you've seen that, right? But I don't
I
think that
think so.
Replens has the right osmolality. He talks about ones that are safer, that are better
Okay.
for the vagina with
So
the right
that's different than a
osmolality. So he talks.
lube.
Yes, yes, a
Okay.
moisturizer. Some people, okay, so it's for a different thing. So some people feel
This
that
is
their
news.
vaginas, oh, good. So the vagina just feels dry. It feels sandpapery. It feels uncomfortable. Not just for sex, it just feels uncomfortable. So those people do better. They want a moisturizer. And so you use that, like, a few times a week, like every few days. You put this little, you just insert this little, um, like hyaluronic acid, I think would be
Okay.
that would be one, and a good moisturizer. So, but they're moisturizers, and that's different from a sexual lubricant, which is
Okay.
going to be very slippery, and
Slippery.
yeah, yeah.
Okay.
So I just direct people to look at Dr. Greger's. If you just, you can put in, vaginal. I think vaginal moisturizer into his
Okay.
uh,
I'm
space
going to
to
look
look for
that up
things.
because I just want to hear him talk
Okay.
about that. Okay. And then
Yeah.
I want to go back to, because you said the same thing to me that Jane said to me. And I feel like my head is in the game. I feel even maybe more attracted
Mm.
to my husband. I feel I'm definitely,
Uh-huh.
my head's not thinking of other things.
Uh-huh. Good.
I do feel like things have switched because I used to have orgasms with just penetration and now it's like it has to be on the outside.
Mm-hmm.
Like clitoral stimulation. So I think that that's one thing and we've had to like switch our game up and I think we've done a really good job of talking about it. And this poor guy, he's working his ass off. That's all I can tell you. Um, but
Mm.
so I think we're on the right track. I don't know. Maybe this is just how it is. I don't really know the cause of why it's taking me longer. Um, but it's still happening. So I guess that's the good news. So I don't
Have
know.
you
I don't know if
tried
there's anything else what?
sometimes, well, sometimes you do need a different kind of stimulation. So I mean, I think you have to be one thing that has worked for us, and I don't know whether you've tried it, but ice. Have you ever tried ice?
Ice?
Ice.
No.
Ice.
What?
Yeah, it's just
You put
more
like an ice
intense.
cube on it?
So,
You have to keep the ice
well,
cube. Okay, make sure it's wet.
no, 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 on and off. So a little bit of ice on and off. It just like wakes up the nerve endings.
Oh, okay.
So
This is
ice on
good
your inner
information.
thighs, ice. It's just more stimulation. So on and
Okay.
off. And that's the way to get to a better orgasm, is like getting you up there and then stopping it.
Okay, so
So
you
and then
keep a
and
little
building
ice
and building. Well, you
keep a little
can.
ice
I
next to
mean,
you,
you
and then
could
you
you
put
could
it
get
on
some
your
ice.
thighs, you put it on your vagina, like what? Just kind
Well,
of
whatever feels
play with
good.
it a
Yes,
little?
you'd be surprised because it's more stimulation than you would just
Okay.
normally get. It's different and it's more, and it sort of wakes that tissue up. At least that's, and then take it
Okay.
away, right? I mean, don't
Yeah,
leave
you
it
don't wanna
on
keep it
any
on there.
place. Don't
Yes,
burn
like an ice
anything.
pack.
Right? No, no, no. But and it gets wet because your own body is so warm, and
Yes.
so, but it's just a little bit more stimulation than your nerve endings have been used to. So try
Okay,
it.
you're
I
bringing
think
it.
that
You're
that
bringing the
yeah.
information.
And then always,
Okay.
take it, if you want to have a really good orgasm, then you try to take it up to a certain place where you're very close, and then you stop. And then
Mm,
you go back up, and then you stop. I don't know if it's
dang.
really like tantra. I'm not saying that it's like this is my own thing, but then you will have a very, very big orgasm, and it'll be worth it.
Okay.
And then what's nice about having a really good orgasm is that you want to do it again because
Yes.
it was a good experience. But on the other hand, where you are, where it's like, oh my God, he's down there forever, I'll never come. Then that is like, who wants to do that again, right? So
Okay,
it's
it's
like
not
this
like that
vicious.
either.
Okay, good. But
It's
I'm
not
just saying,
like
for
that
some
either.
people, I'm sure it isn't, Lauren. I didn't mean to using that as an example. I'm just saying that when people have bad
Yes.
experiences, and this could be with
Yes.
pain also, when people have bad experiences with sex, they don't want to do it again. And that
Right.
becomes worse and worse because then the vagina gets closed, more closed.
I think that sometimes you have to have these hard conversations with people, with your partner, and I think it brings you closer if you do it in a loving, positive way. And I've also heard that um, women don't want sex less; they just don't want to put up with mediocre sex at this point in life. And so,
Ooh,
So don't take the blame, girl.
mediocre sex.
If don't take the blame, if it's mediocre and you need to have a conversation
Mm,
to get it to the next
right.
level. I think as long as it's loving and it comes from the right place and it's not accusatory, like you're not doing it right, just like I want it to be more
Wow,
fun
yeah.
and I want to take this, I want us to be able to enjoy this part of life or whatever. I think
Right,
that
right.
that's good too. I heard that somewhere. I was like, yeah, that's good. Okay, so is there something that can help if somebody's having low desire, like a
Yes.
hormonal
Yeah. So
thing that can help?
if, thank you. Yes. If women are really unable to reach orgasm, they just need some help. We have used testosterone cream. It's a 2% testosterone cream. Then it's like a pea-sized amount, and you would just rub it around, not on the clitoris, because it can cause it will cause clitoromegaly, which you don't want. But you can rub it around the vulva and around the clitoris, like around, and it should help, like every night, a little bit around that area, and it should help you for having to make those tissues more responsive and to reach orgasm faster. So that's something. And we use testosterone cream also sometimes when there's been injury to the vulva and we're trying to repair it. We use estrogen cream, but if that doesn't work, I've actually used a combination of estrogen cream and testosterone cream to help repair. It's just, those tissues do respond to those hormones,
Okay.
testosterone too. Just be
And
careful. You don't want to put it right on the clitoris because you
okay.
won't be happy.
Okay. Let's talk about menopausal hormone
There.
therapy. Is that what you called it?
Yeah,
You
menopausal
talked a
hormone
little
therapy.
bit about estrogen creams or things like that. Are those what do you think is safe? How do you know what you need? Do you need a blood
Mm,
test? Do you need a urine test? What
mm,
do you need? Is it
right,
different if you've had a hysterectomy? Can you talk about all those things?
right. Well, certainly for women who go through sort of an early, a very early menopause, like they actually have um, their ovaries stop functioning at a very young age, like 35 or 40. They definitely need hormone replacement therapy, and it can go on to about the age of 52, the average age of menopause. And they need estrogen and progesterone if they have a uterus, and there's it's safe and it's recommended for their bones, for everything, that it just is, because it is in that case sort of replacement, right, of what they would have had. If women have oophorectomies, if they have their ovaries out, and I think it sort of depends on what it was for, but a lot of times, let's say they had terrible endometriosis, so they had, which is reversible sometimes with a plant-based diet. But if they had terrible endometriosis, and I certainly have friends who've had hysterectomies at very young ages because of severe endometriosis, they should also be on hormones until the age of menopause. Now it gets very tricky for women who are perimenopausal and they're starting to have irregular bleeding and um, infrequent bleeding. Let's just start with that. So infrequent bleeding and hot flashes and night sweats, and they're miserable, and they're moody, and they're depressed and anxious, and their sleep is disturbed. And if they're only, let's say, 47 and they're still having some periods, you could put them on low dose birth control pills. So very low dose birth control pills, and we have it is a little bit more hormones than hormone replacement therapy. But if they're still menstruating and they're sort of perimenopausal, that still is one of the treatments for the perimenopause, would just be regulate everything with birth control pills. And I had been on birth control pills until I reached about 50, 51, and then I went on hormone replacement therapy very, very briefly, and then I stopped when I became plant-based and didn't need it anymore after about a year. And but if you really have, now you made it through the perimenopause, you haven't had a period in a year, and you can't believe it, like you're just having hot flashes all day long and quite miserable, then you have to think about, and night sweats and all those other symptoms like skin crawling, I mean, you just name it, you can have it. Then you have to have a discussion with your doctor about what's safe for you, and it depends on your own on what you, I don't want to say what you fear most, but what you feel is most important for you in the short term and also in the long term. So there've been some interesting studies. The most important study that came out in this country was that Women's Health Initiative. It was started in
Mhm.
1993 because which is when I first started in my practice. And so before it was stopped, a few years later, we really had some interesting observational studies that showed that menopausal hormone therapy was just like this panacea, was going to help your brain and your bones and your heart. It was just going to be great. And I remember going out and really talking it up. And I apologize for that because, then the results came in and they actually had to stop the Prempro arm early because of more um, strokes and more breast cancer and no benefit. And then they stopped later, just the Premarin alone arm, because of more
But let's be
strokes and.
clear. Yeah. This
Mhm.
is that this was with just Premarin and Prempro, which
Yeah,
is
yeah,
made
yeah, yeah,
from
yeah, absolutely.
horse mare urine, and that's different
But it
than
is
what
right.
what we're using
Yeah, yeah,
today,
yeah.
right? I
Well,
mean,
some people still use it. Some people feel like this is a known. I don't use it because I'm vegan and I would never
yes,
use it. Okay, so
right.
vegans don't use Premarin. They don't
We've
use
had
Premarin
one
cream.
guest
They
who
don't use Premarin.
swears by it. Yeah, and it freaks me out.
Right.
But
Well,
did
you know,
typical go
okay,
ahead.
so that was the Women's Health Initiative study, and yes, it was on Prempro using Prempro, or and it was a randomized controlled trial, thousands and thousands of women, tens of thousands of women, um, and Premarin alone, and it was stopped early. But then there have been,
It
for
was
all those
stopped early
reasons,
because
but
people were having strokes and
yes, they were having
okay.
strokes and they were having
Yeah.
more breast cancer, and so
Mhm.
it was like a mass exodus from hormone replacement
Right.
therapy at that time.
Right.
But then later, there have been some follow-ups. There was a 13-year follow-up. There was a 20-year follow-up. They actually found in the 20-year follow-up, and this is interesting, that women who had been on the estrogen alone arm had
Hmm.
less breast cancer than women who were on nothing. So, and there's still benefits in terms of colon cancer, in terms of even lung cancer, in terms of diabetes, in terms of uh, bone health, right? So there are some benefits. And there were some long-term studies that show that if you just looked at women between the ages of 50 and 59, so that was the problem. Another problem with the Women's Health Initiative study is that women were average age 63, right? 63.3.
Mm.
So if you just started looking at a subset of women between 50 and 59, and you just looked at people who took it for just 5 years, then maybe the risk benefit ratio kind of shifts and all cause mortality actually goes down. So that was a study, you can look that up. That was from the Endocrine Society, they pulled out just those women between 50 and 59. So for a while, we were just saying, okay, and this is what probably most people still think, but there have been some later studies, which I'll talk about, but that it's, all right, we'll have you on hormones for the first 5 years after menopause, and then we'll wean off or we'll just stop it. Because then the risk benefit ratio starts to shift and we just don't think. Then now there have been some additional studies looking at women using hormones even after 65. So there was a huge study, I think it was like 10 million women, that was done looking at using Medicare pharmacy records and hospital records. Medicare. So these are women who were 65 and up. And well, I wouldn't have given hormones to someone who was, I have had some people on hormones who didn't want to give it up. But so even that, and they were looking at many different preparations, oral, transdermal, vaginal, different kinds of estrogens, different kinds of progesterone, right? So it was a huge study. And they actually, I saw data that said, even for women 65 and up, that if they're on a transdermal estrogen alone, that there are some benefits. But
Okay.
then I went to the International Conference on Nutrition and Medicine, and there was a woman from Denmark, a researcher who had some research about a very large study that they did in Denmark about Alzheimer's. And I have to say, and all-cause dementia, because this comes up again and again. There were early studies that looked like estrogen was really good for the brain. I remember being on a podcast and the doctor asked me and he said, "Don't you think it's really good?" Blah, blah, blah. But I was always a little reticent because I feel like there were also studies, at least in the Women's Health Initiative, that showed that it was not good for the brain, not good for dementia risk. The study of the women between 50 and 59, I think, was sort of equivocal. But this study from Denmark, I I feel like this is sort of the end of the road because hormone replacement therapy, they used estradiol. They did not use Premarin. They used estradiol. It's true they did not use natural progesterone. In Denmark, they use a progestogen. They just use a progestin. They don't not. I don't think it was Provera, but they use some other progestin. But they don't use natural progesterone. That's the only difference. And most women are on both. So that was most of the women in this study were on both. But it definitely caused increase in all-cause dementia and Alzheimer's. Even just
Oh,
using
really?
it for a short period of time.
Wait,
Yes.
the
And
progesterone or the estrogen and progesterone
both,
together?
both, both. But then she did a subset. She took a group out. The reason they didn't want to just look at women using estrogen alone is because those women have had a hysterectomy. And I think, and I know actually, that a hysterectomy itself is a risk factor for dementia. So that would sort of muddy the waters. But they did take out a subset of women who were on estrogen alone. And again, being on hormones, being on estrogen, on estrase, increase the risk of all-cause dementia and Alzheimer's. So from that, I
Okay.
feel like it doesn't really, I mean, if you have no risk factors and you feel like your cholesterol is super duper low and you have no dementia in your family and you are suffering so much and you want some hormones, then I would still give you hormones. I would give you, if that's what you want, but I'd be very strategic about what you need and what you want. There's no reason to take oral estrogen if you just need vaginal estrogen, right? And if you
Yeah.
have mostly anxiety and then maybe an SSRI would be better. And if you're just having hot flashes, maybe the neurokinin B receptor antagonist would be better. So um, I think we have to be. I think we really, this is a place to be very individualized. If you want to be on hormones and you feel like you could accept a small risk of all of this, then that's fine.
Okay. What about pellets? What do you think about
Yeah.
pellets? I've had a
There
lot of
are these
friends.
depot, yes,
Yeah.
there are these depot forms of hormones. I really worry about them because once they're in you, you can't remove them. And I think it's a very odd, I've never used them and I would never use testosterone pellets, and I don't give people testosterone. It was interesting. There was a formulation of Premarin with testosterone. It was called Estrotest. And
Hmm.
I don't even know if it's on the market anymore, but it was this idea that, and it came in two doses even. Yeah, there was two doses. So but we don't really recommend that people take testosterone.
So the
Some
pellets are
people felt that it really,
testosterone.
well, you could probably you can get estrogen pellets too, but why? And just because it's easier? I mean, you can, if you want estrogen replacement therapy that's super duper easy, then use the ring. There's a fem ring, comes in two doses, the 1 milligram and the point and the 0.5, and that's that's menopausal hormone therapy. It's not just for the vagina, but it's in the vagina, and you put this little silastic ring inside. They actually came up with this. They use rings now for birth control, right? Because there's the Nuva ring, which is for birth control, and then they have these two doses of hormone replacement therapy or menopausal hormone therapy that can be used that are in this ring, and they also have the estring, which is a very very low dose just for vaginal dryness, just for
Okay.
they call it, right, right, so genitourinary syndrome of the menopause. But you could, and you just change it every 3 months. So that's super easy, right? Just 3 months, just stick it in and go away and don't think about it.
When it comes to the care and maintenance of your vagina, I feel like some people over clean theirs. I just kind of use water. Is it what I think it's like a self cleaning oven, no? But what
And
about just
in terms of
washing it?
washing, okay, you don't need to wash the vagina.
Right.
So
Just
I guess when
water,
people are
right?
younger and they're having, yeah, if you need to, like you could always, if you can and want to, you could just take a little water or even vinegar and water if you wanted to, very light vinegar and water, like not white vinegar, just not, but not to the point where it would burn you, but just in your fingers and just sort of swish it up with your fingers or swish inside if you feel like, especially I guess if you're having sex with men and they're ejaculating inside of you and you just feel like it would be cleaner just to get that out, you could use your finger and water, but you do not need to douche. In fact, that could
Oh God.
introduce bacteria higher up.
Yeah,
So
yeah, yeah.
don't, and nothing like this strawberry. I mean, don't do any weird
But I
flavored
just mean, yeah,
things.
I just mean like when you're normal taking a shower or a bath, you don't need like special stuff, right? You could just wash it with
No,
water. Okay.
no, right, absolutely.
Okay.
And if it's sensitive, I'll tell you. I just wanted to say one other thing about being more sensitive when it's drier. It is more sensitive to irritants. Now, maybe your group of people know all about vulvar irritants, but maybe not. So there are products that are scented and that are even antibacterial that are really not good down there. Like I remember seeing people. I often see people who have vulvar irritation and itching, and inevitably, when I ask them what they're using some soap like a Caress or a Dial or an
Oh.
Irish Spring,
Oh, damn.
um, right? And they're using a detergent that's got scent in it. They're using bleach, and or dryer sheets. Dryer sheets are
Oh, right.
terrible, terrible. Or they're wearing pads that are bleached, like little mini pads, because they feel
Right.
like there's that sort of that atrophy kind of discharge thing that they don't like, and uh, so they're using these pads, and they're very irritating. I've even seen people who wash their thong underwear in a very strong detergent, and they're irritated from the thong,
That's a
which I
good
don't wear,
point.
but people do. So you can,
S
and then that's totally reversible. Just don't use any soap, or just use Dove bar soap, or Basis, Basis. I like that. It's completely unscented, and use an unscented detergent. Try to get things that are all natural. Don't use bleach in your underwear. Don't use dryer sheets in the dryer ever, because those are phthalates, and those are anti-testosterone, and those are endocrine disruptors, and you should really try to minimize your exposure to phthalates and parabens and things like
Yeah,
other
that's
endocrine
good.
disruptors.
That's
Yeah.
good. And then after you have sex and maybe you have been ejaculated into, I've heard that you should try to pee and then wash your vagina to keep you from getting a
Oh, for
UTI. Is
bladder
that
infections.
right?
Oh,
For
bladder
bladder
infections. Oh yeah, let me
infections.
tell you about that.
Okay.
I really suffered when I was with men. I really suffered from this. So I did learn about how to prevent a bladder infection. Although deciding to be with women has really helped. But beside the point. So
Another point.
yes,
Another, if you can
yeah,
be a
it may be
lesbian,
an
be
option.
a
It
if
may
you
be an
want to be a
option. Yeah.
lesbian,
Right.
okay.
Go for it.
Okay,
Okay.
so
So, okay,
back
how
to
do you do it? So you have to understand that it's usually your own bacteria from around the anus and the perineum that are getting pushed up inside your urethra. It's not from somewhere else. It's not usually from him, although I suppose it could be, and it could certainly be if you're using a toy in one place and then another place. So never put anything from the anus into the vagina. That's
right.
who would, who would. But it is your bacteria. So the first thing to do, and I know it may not be the most spontaneous thing, but maybe you could use a wipe. I don't know, but I would wash. I would wash around the anus before you have sex, just to
Okay.
remove any of those bacteria. And I think it's nicer if you're cleaner, right? So just
Sure.
you know remove that, because
No
right.
downside.
And then right, no downside. And then make sure you pee before, because you don't want a
Before.
lot of,
Okay.
yes, because you don't want a full bladder. The bladder is like a medium. The urine in the bladder is like this medium that's just ready for bacteria to like start growing in it, right? So pee before, so that there's no urine in your bladder, and then you can have sex, and then get up right away if you can and pee again.
Okay.
Pee
That's
again, and then drink some water, so that within another few hours, so these little bacteria can start to climb up. You want to keep washing them out,
okay.
so they don't have a time to get up there. So one of the worst things you could do, I guess, is don't bathe before, have sex, lie there in bed, wake up the next morning, and you're gonna have a bladder infection, because you have this
Right.
full
Okay.
bladder. Then the bacteria got to, they irritated the urethra, and then they just climbed up. It's only 2.5 centimeters into the bladder, where they're, oh my god, there's all this stuff. I could just have a party, and then you end up with a bladder infection.
What kind of exercises can we do for our pelvic floor? Like if, we're maybe sneezing and peeing a little
Yeah,
or anything like that.
right,
What is there some things
right.
we could do for
Well,
that?
yes, the Kegel exercises, as long as you do them, and
How many do
there
you
are
need to
probably
do?
lots of, well, how many do you need to do? You could you probably could look online for some videos to make sure you're doing them correctly, but you also might want to visit a pelvic floor physical therapist who could really help with this, because actually pelvic floor physical therapy does help, because they're able to really give you that feedback. When you're at the doctor's office, you can actually practice. And I've seen people where I've had my fingers inside, and I said, okay, now squeeze, and
Squeeze.
there's
Okay.
nothing there.
Is that how
And
you
also
could tell
squeezing
if
your
you're
butt. Well, yes, and when you're having sex, you can
you
actually
can
say
squeeze?
to your partner, "Are you feeling that squeeze?" So you could
Yeah.
work on it that way. But a lot of times people are just squeezing their butt. Like you could
Yeah.
squeeze your butt. That's not going to help. And squeezing your abdomen, that's not going to help. You really want to isolate those muscles inside. And so what I think about is dropping like a line, like if you were a puppet, but dropping a line right through the middle of you, down to the top of your vagina, and then you're pulling up. You're pulling up on that line.
Right.
So that's what I try to do. You pull up inside. You pull up
So
inside, and you
but you
go.
could put your finger in there and squeeze and see if you're squeezing it. You
Yeah,
could put your
but you
own
can
finger
also,
in there
once you know,
and
yes,
see
once you
if you're
know that you're
squeezing
doing
it.
it right. Yeah, but then you want to just squeeze and then squeeze again. So you squeeze up a little bit more, and then you let it go. And you squeeze up a little
I'm
more,
doing
and
it
then you let it
now.
go. And they
I'm
probably,
doing it now.
so good.
How many do you
So,
want to do?
if you
How
could
many
do
do
it,
you do?
well, if you could, if, they say, if you could do 10 or 15, an hour while you're awake,
An
it might
hour?
really make a
Shit.
difference, especially
Okay.
with some estrogen. Well, the other thing would be to talk to a physical therapist and see. But if you're, there are other things you can do to keep from leaking. So one is to pee more often. Don't have, the worst thing is to be holding it. You're holding it, and then all of a sudden you're washing the dishes. And it's like, oh my God, I'm going right now. Right. So, but there are people who are, really can't run and they can't exercise. They can't be on a trampoline or they do the things they want to do because they're leaking. And then they should see
Yeah.
their doctor, because if you've had some kids and you really have this decrease in the angle between the bladder and the urethra and it's dropped, then I'm not sure how much benefit at that point you can really get from Kegels. It's worth a try, but you might actually need a lift of that area.
A bladder lift? Is that what you're like a
A
little
surgery,
surgery?
yes. A well,
Okay.
they do different things, but yes, an MMK,
Okay.
yes, or yeah,
Well, I think we've
birch
covered
procedure.
a lot. Thank
I
you.
think so
Oh
too.
my gosh.
Thank you.
Thank you so much. I'll have to have you back because I really actually have a lot more questions, but um,
Well, thank you,
thank you
Lauren.
so
Thank you
much,
so much.
Dr.
This has been fun.
Deborah. Thanks for listening, friend. From my heart to yours, be well until we meet again.